Welcome, everyone. This is Dave Clausen, the Director of the Mid-America Prevention Technology Transfer Center, and wanted to welcome you all to this live stream of Making the Steps of the Strategic Prevention Framework Work for You. Step 3, Planning. Well, while we give folks time to log in and get set up for this live stream, we did want to share just a couple things setting the context and the stage for today's broadcast. This was initially a live webinar, but due to some technical difficulties, the webinar ended up crashing on us. We wanted to still bring you the great valuable content and materials. So this is our workaround. We will be broadcasting that webinar recording for you today, and our presenters will be on hand to address questions through the live chat box on YouTube. For those that may have never attended a YouTube live stream before, we want to share just a little bit of information on how you can ask a question during today's broadcast. The first step would be to log into your YouTube account. You'll need to select your Google account or add a new one if you don't already have one, and then sign in with your email address and password. Once you're logged in, you'll return to the live stream. And the screenshot below is what it will look like. On the right-hand side, you can see the large gray box that says Live Chat. That is where you'll be able to ask your questions during today's broadcast. Our presenters will be on hand monitoring that chat box and addressing questions as they come up. Now, if we have a large amount of questions, we will go ahead and compile those questions and answers and then send that out to your emails since we have those from the registration. So thank you again for coming with us on this journey and trying out a new means of delivering great content to you. Hopefully this will make it more accessible and more available to you. So thank you again, and we will begin today's broadcast.
Welcome to this webinar recording, Making the Steps of the Strategic Prevention Framework Work for You. This is Step 3, Planning. We'd like to welcome you today. We want to make you aware that this training and the Prevention Technology Transfer Centers are funded by the Substance Abuse and Mental Health Services Administration. Opinions expressed in this webinar are not necessarily the opinions of SAMHSA. Good morning, and I am Wanda West, the moderator. I work with the Southwest and the Mid-America Prevention Technology Transfer Centers. I would like to introduce to you our presenter for today. This is Hayden Center. Thank you, Hayden, for being here with us. Hayden has taught at several universities over the past 30 years. He has also been a licensed professional counselor specializing in addiction issues for over 30 years. He has worked in the field of prevention for more than 30 years. He has worked with numerous agencies and organizations at the national, state, and local levels as an evaluator. His experience includes working with several projects to develop databases, collect and interpret data, and produce data dissemination products and materials. Welcome, Dr. Center. We appreciate you being with us here today, and we'll turn the time over to you for the presentation.
Well, thank you very much, Wanda, and I appreciate this opportunity. I think that when we get together and think about how we're going to try to effectively solve these problems in our local communities and states, that's valuable and precious time. So I appreciate everyone that is taking part in this today and listening and trying to absorb this information. You'll see on this first slide something you should be very, very familiar with, the Strategic Prevention Framework, many times referred to as the SPIF. And the Strategic Prevention Framework is the underlying conceptual structure of this and actually 7 webinars that are being presented. I have the privilege of doing both step 3, which is your planning step, and then also step 5, which is evaluation. So I'll be back with you in a couple of months, and you'll find, I think, at that point in time that what we do in step 3, planning, in fact, what we did in step 1 with assessment and capacity, that it all ties back into evaluation. And as you look at the strategic prevention framework, you see that it's not, that this graphic, that it's not in discrete steps. And that was done for a purpose. It was to show that there's a lot of overlap between these steps. And sometimes, just to give you an example, sometimes you plan very, very well, and you think that you have a really good strategy. You implement that strategy and you find out that you're not getting the immediate changes that you hoped for as you start to do your evaluation on your initial outcomes. And so you may then go back to assessment to assess what is going on. Why is that? Why are you not meeting those outcomes, which might mean then that you have to look for a different capacity. You may have to go back and replan and then re-implement. And so it is a stepwise model, and you do at certain points in time emphasize certain steps more than others. But again, it is a model that flows back and forth. It is also a model that never ends. Once you get to the evaluation phase of a project, then you're going to need to reassess and adopt and plan and improve, especially as conditions change. In the middle of the strategic prevention framework, you see 2 components that actually overlap all 5 of the steps. One of those is cultural competence, and I think everyone who is viewing this and listening knows the value of paying attention to and assessing for and being knowledgeable of the culture of the community in which any intervention, program, or practice or policy is implemented. And so cultural competence needs to be part of your assessment process, as you look at the capacity in the community, as you develop a planning team, which we'll talk about in just a little bit. You have to be very, very aware of all the different aspects of the community, all the different sectors of the community that make up the community, to make sure that you are meeting the total needs of the community. And of course, that then is part of implementation as well as evaluation. The other component that you see there in the middle is sustainability. And sustainability is really the ability of a program or practice that is working to continue to be used over a long period of time in a particular community. The sustainability piece, I actually was working with a system that was doing some work with Center for Substance Abuse Prevention when the strategic prevention framework was developed. And so I and 3 other colleagues that you'll see the first article that's referenced in the reference section led a national approach to developing a sustainability framework. And so we published the article that you'll see in the references, and that particular framework has been used not only for the strategic prevention framework, but a number of state systems and other federal agencies have used either all or part of that framework as they thought about sustainability. So I'm very, very, very committed to sustainability. Anytime we start to make progress in a community, we need to do everything possible to ensure that that progress will continue over time. And so I've been working in that area of sustainability for the past 20 years. It's a passion, and it goes through every phase, again, of the strategic prevention framework. So near the end of the presentation today, as I've talked to you about the immediate task of planning, then I'm also going to address what are some elements that you need to be considering as you go through the planning phase and the implementation phase to make sure that you are developing a high likelihood that whatever you're doing and what you're putting all this work in and building all this buy-in in the community, that it will sustain itself and that it will make long-term changes in the community. So the strategic prevention framework is the foundation of what we do in prevention. So moving now to the specific stage that I'm tasked to talk with you today, and I have worked with numerous what typically are called grassroots organizations in planning, and have some ideas about what is more effective and less effective. I always go into working with any new community with an idea of what I hope to accomplish, and then hopefully am able to match that to what is needed and what the members of the community hope to accomplish. But there's a basic framework that we follow as we plan. And so you've already dealt with this first issue, both in assessment and capacity building. That is to prioritize the risk and protective factors associated with the substance misuse problems. Why is that so important as you go all the way through this model? Well, the risk and protective factors, and there's two types really. There are what are called proximal risk and protective factors and distal protective factors. And especially with proximal, and by proximal we mean risk factors that are very closely associated with the risk of the behavior happening right now. Distal risk factors would be those that are part of the problem complex, but that if we change those, we may not get as strong a change in the outcomes that we hope for. Many times it takes 2, 3, 4, or even 5 years to start to see real lasting changes in our long-term outcomes. We hope to have them as soon as possible, but we many times from an evaluation perspective look at what are those risk factors that will need to change first so that eventually we will have a change in use, change in prevalence. And so targeting your efforts towards those risk factors and making a conscious effort to decrease those risk factors as well as increase protective factors which buffer risk in the community should be where you are putting your resources. Once you identify those risk and protective factors, then you look for what will be appropriate programs and practices that will address each priority factor. And so innovations, which are new ideas, are very helpful, but many times we don't have a lot of evidence as to whether they work or not. So it really is a preference, a strong preference. In fact, I would almost say a need to make sure that you go first and look to programs and practices that have an evidence base that will give you a high degree of confidence that they will work in your community. You then need to understand that prevention as well as substance use and substance misuse happen at several different levels in the community. The risk factors can be something that someone has internally as an individual, but there are also family risk factors, school risk factors, societal risk factors, and so you really have to combine programs and practices to ensure a comprehensive approach. Very rare that just doing one thing, for example, just doing a prevention program in the high school is going to have an effect on the entire community. That prevention program is important, but it needs to be combined with lots of other efforts that are going on in the community. And then as you've gone through this very extensive planning process And those of you that are listening to this, you're all leaders in prevention. So you need to understand this because you need to transmit it again to everyone that you work for and work with, that we have to take a very systematic approach to planning, which means it may take more time planning than some people are comfortable with, but it's very necessary to make sure that you, first of all, are solving the actual problems that exist, and you're using an approach that's very likely to work. So out of that, you build and share a logic model with your stakeholders. And this logic model basically is your roadmap. This is what we're trying to do. This is why we're trying to do it. And this is how we will know when we have done it. And so the logic model then becomes something that you share with all your stakeholders. They buy into it, hopefully, and feel like they are part of aspects of that logic model. So here's a graphic that just, I know some of you are probably more visual learners and some are more auditory and kinesthetic, and so we do want to pay attention to as many of those different learning styles as possible. So this is a graphic that really just puts that those ideas, again, that you have identified in your assessment phase, your problems and your related factors. You look then at what are the risk and protective factors that are contributing to those problems, and now we're going to plan programs and practices that will hopefully be effective in reducing the risk and protective factors, which will also eventually reduce the problems and related behaviors. This is just another graphic that outlines in a little bit more detail the process that we're talking about. So step 3, planning, we again prioritize risk and protective factors, and we use the ideas of combining both importance and changeability. Importance being, and I'll talk about this a little bit more in a moment, but importance being, how much is this risk factor actually contributing to the problem? But then we also have to look at, is it something that when we put our resources towards changing it, that we're likely to be able to see a change? And so when you balance importance and changeability, then you start to look at what are going to be the most effective strategies now, rather than, again, maybe changing a risk factor that really is not going to have a huge impact on the particular problem behavior, or you choose a risk factor that really at this point is not as amenable to change. So you have to think about both of those concepts. Then we want to make sure that you select interventions that are both effective and fit within the culture and the practices of your community. If you pick an intervention that has been shown to be effective but does not have a practical fit in your community, then the implementation phase is going to be difficult, as well as you're probably not going to achieve your outcomes. And I can almost guarantee that you will not sustain the program if you're somehow able to get through the implementation process. So again, really need to consider that. We need to think about all 3 of those factors: effectiveness, conceptual fit, and practical fit. And then you develop a comprehensive plan that aligns with this logic model. And again, the logic model is usually very concise. The plan then is much more detailed and also assigns responsibilities and has a timeline and all of those things that we know needs to happen so that both the planning group, as well as the individuals in the group, are accountable and know when and how things are going to happen. Very, very important, though, to have a detailed plan that goes along with your concise logic model. So these are 7 steps that you should think about in your planning process. The first is assemble a planning team. I'm going to say this, and hopefully this is something that will not resonate with anybody on the call, but I've been doing this, as Wanda emphasized in the introduction, for over 30 years. I've learned a lot during that time, some from success, some from not being very successful, and some from observation of what others have done. And so I just want to caution you. You want to go back to the idea that we have to have cultural competence through every step in the strategic prevention framework. We need to assemble a planning team that represents that cultural diversity in the community. And so I have seen projects where one or two people planned it all in their office in seclusion, or maybe with 2 or 3 staff members, then tried to take it to a coalition or another group, and they didn't get the buy-in. And you have to go through that. It does sometimes take more effort to assemble a planning team, but you need it for the buy-in through the implementation. But also, as I'm going to talk about at the end of the presentation, what you do right now with planning, if you assemble the right planning team, it makes it more likely that you will sustain the effort over time, because you're getting buy-in from members of the community and members of organizations that you will need their support as you attempt to sustain this past an initial funding period. So it's very, very important. The second thing you need to do is train the planning team. Another mistake that we sometimes make in prevention is thinking that everybody that comes and joins with us in the effort has the same thinking processes as we do. And they don't. And there's not that's not a criticism. It's true that whenever you're solving a problem, that there's usually an accepted way or a more proven way to think about it. But if you've never done it before and you've never been trained, then you're likely to fall back on other strategies. Just to give you an example, there has been some research that has looked at the way that novices and experts solve problems. A novice, when presented with a problem, will spend 80% of their time generating solutions. An expert will spend 80% of their time defining the problem. And so what happens many times when people have not been trained in how to think about prevention and how to think about reducing these problems, they'll spend a lot of time coming up with solutions, but not necessarily evidence-based solutions and not necessarily solutions that are going to be best fit for the community. I always have a purpose. I have worked with coalitions for a number of years. One I have worked with for over 20 years and still do work with them today. It's always, as an evaluator, and I want to share my bias, but as I go into work in the planning with a group, I want to move them towards always thinking evidence-based and becoming data-driven in their approaches. Data-driven means that we are looking at the data that tells us where the need is. We're looking at the data to tell us, and inform the planning, that we're looking at the data when we evaluate the success. And when I can get the leaders of the coalition to follow that form of thinking, then we can start to really do important things. But it does take some formal and informal training, in my experience, to make this happen. Then you analyze the local risk and protective factors. Choose the factors you'll concentrate on. We're going to talk about, again, how to do that in just a moment. Research and choose an evidence-based approach that can be used with the risk and protective factors you've settled on. Create an overall plan for the effort, and then present the plan to the community and gather support. So these are just kind of the basic steps. It's very easy to read them off a PowerPoint presentation. In reality, there's a lot of effort that goes into this, but I firmly believe that putting the effort forth at this stage will make your implementation much more likely to be effective. It will make your evaluation become very, very clear as to what are the important pieces of information that you need, and it will much more likely lead you to be able to sustain the effort over time. So it's a very, very important step. One of my favorite philosophers in the world is that great catcher from the New York Yankees named Yogi Berra. And he had lots of Yogi Berra-isms, but my favorite is, if you don't know where you're going, you might end up someplace else. So planning, you know, I really am glad I got the privilege of doing this particular step, because the planning step is so, so, so important. Implementation is where the change happens. Evaluation is where we can start to show everyone the change has happened. That can be an exciting stage, but without good planning, you don't get that excitement at implementation, and you don't get to share those success stories. And make that are both high importance and high changeability. So I want to talk a little bit about what importance means, and then a little bit about what changeability means, so you can kind of pay attention to some of these. So importance really describes how a specific risk or protective factor affects a problem. To determine its importance, you first of all, a question that you might ask: how much does this factor contribute to our priority problem? Another question: is this factor relevant given the developmental stage of our focus population? That developmental stage is very, very important. You know, when we look at, for example, some of the more recent issues that prevention has had to deal with, such as opioid overdose, well, we see that, you know, that's not happening among our middle school students. That's happening among our young and middle-aged adults. And so the developmental stage of the focus population becomes very, very important if you're going to impact risk factors that are going to make changes that matter as quickly as possible. Another question: is this factor associated with other harmful behavioral health problems? And we do see that sometimes when we change a risk factor that's associated with a substance use issue, we also get changes in academic performance, changes sometimes in other risky behaviors, such as the transmission of AIDS, hepatitis C. And so, you know, that can raise the importance of a particular risk factor if it's also related to other problems in the community. So now I want to talk a little bit about changeability. And that is, again, the ability of the community to actually be able to influence or change in the hoped direction by the community. So here's a few questions to think about. Do we have the resources and readiness to address this factor? Go back and look at stage 2 capacity. You see now how these steps flow together. as you're planning, you're going to have to go back probably and look at capacity. And do you have the capacity in the community to actually be able to change this particular risk or protective factor? Does a suitable program or practice exist to address this factor? And we're going to talk about this in just a moment, but we have a high preference that you use something that has a strong evidence base that it works. Now, sometimes, we'll talk about this in a little bit, sometimes that program or practice has to be modified in the community. And when it is, then that changes your evaluation burden, and you're going to have to evaluate that particular modification. But sometimes we do have to rely on sources of information that maybe the program is more promising than what we would actually accept as evidence-based. But that's usually your second or third option. And then the last question, can we produce outcomes within a reasonable time frame? And again, that becomes very, very important as we think about this, because funding many times is time limited, but for some of our issues, if we're not starting to make changes immediately, problems are getting worse and people are suffering. And so we have to be as efficient as possible, while at the same time making sure that we're not rushing and creating a program or an intervention or a practice that's not likely to be very effective. So again, importance and changeability are key factors in considering the approach that you're going to use in your planning process. We want to ensure a comprehensive approach. And so as part of that, we see that you have to realize that there are multiple social contexts. And so we need efforts that impact individuals. We need efforts that impact families, other organizations in the community, societal interventions. And if we're not comprehensive in impacting several of those different levels, then sometimes we really don't get the strong effect that we hope for. We know, for example, that risk and protective factors operate across a number of social contexts. And so we also know that those societal contexts of laws and norms are very, very important. So we want really a comprehensive approach that's impacting the multiple levels of the social context. Also considering the cultural relevance in the community and understanding how that impacts and contributes and helps us understand the levels of risk, as well as the social context that we need to focus on. So, during step 2, you're really many times going back and looking at the capacity in the community. Again, you just really need to make sure that your planning team includes individuals with strong ties to the groups that are at the higher levels of risk. Again, that's important for buy-in through the implementation phase, but extremely important for buy-in, again, as you start to think about how we will sustain. So again, what seems like a very, very simple graphic, I think you can see really says a lot about how we need to really make sure that we attend to those different social contexts, and again, to the cultural relevance of the approaches that we're taking. So moving now towards, we've assembled our planning team, we've trained our planning team, we've prioritized our risk and protective factors. Now we come to an extremely important part of the planning process, and that is select our interventions. And so we need to look at 3 basic components or three basic areas that we need to make sure that we address in our planning. The first is evidence-based foundations. I'm going to talk about that in just a little bit, but this becomes very, very important. How do you determine that something is evidence-based? There are actually certain levels of confidence in whether a program or practice is evidence-based. We need to look at the conceptual fit. Is the program designed to impact your priority risk and protective factors? That's your conceptual fit. If we choose this program, are we likely to be able to impact? Does science tell us, does the research tell us that we can have a pretty high degree of confidence that we're going to be successful? Then the practical fit is it going to work in our context? And if a program is highly evidence-based, has a high conceptual fit, but doesn't really fit with the context or the infrastructure of the organization or the community that's going to implement it, then it probably is not a good choice. And this will also impact the sustainability. I'll talk in just a few minutes about some important considerations when you're choosing the intervention to be conscious of, because there's a fairly strong research literature that tells us about interventions that are more likely and or less likely to sustain. So let's talk a little bit about that idea of evidence-based. So basically, evidence-based is when you have documented evidence of effectiveness. Now, the best places many times to find these programs are federal registries. And in the last reference that I provide you on the last slide of the presentation that Wanda will talk about at the end, I have given you a SAMHSA document that guides you through selecting an evidence-based intervention, and in that there's a reference to different registries that you might consider going to, because they've done a lot of the work for you, and they can give you an idea as to how has this particular program or practice been studied, what are the evidence of effectiveness, and give you, again, a lot of other information. You may want to look to peer-reviewed journals, systematic reviews. Again, that's, when you look at, for example, a peer-reviewed journal, one article that supports a prevention program or practice does give us some evidence, but we really prefer that there have been several studies done in peer-reviewed journals with several different groups and looked at a number of different factors. If they've been able to do something called a components analysis, that's wonderful. Those are relatively rare because they are hard to do, take a lot of time and effort in your study, but a component analysis will tell us what are the most important parts of the program and lead most strongly to the outcomes that you're looking for. There are some other sources, but again, one, the Surgeon General's report on alcohol, drugs, and health 2016 includes extensive programs, listings, and descriptions. Your state may have guidelines. They may have published something on evidence-based. Some of the states have done that, and I many times go to a couple of those states when I'm looking because they've developed very, very credible indices and very credible repository of programs that have shown evidence. So you really do want to pay attention to this idea that if you're going to spend all this time and resources, you want something with the strongest evidence possible. And the stronger the evidence is going to mean it's been studied in multiple settings, with multiple investigators, all those things that start to give us confidence that it works over time. If you don't have that, though, then we'll fall back on, having at least one peer-reviewed journal article or a couple that's not as strong an evidence, but it is an evidence-based, or we may look at a particular evaluation study that either hasn't been published or hasn't been published yet, and that gives us some information and increases our confidence much better than if we have no information. But that, again, would be a lesser strength of evidence. Then our conceptual fit is, it directly addresses those priority factors, those risk factors, and as I mentioned before, the practical fit, is it going to work in my particular community context? So this is, again, a graphic, and most of these graphics you'll also see in the last two references on the reference page. Really, those last two references, they're very well put together by SAMHSA, and I would suggest that you look at them and use them as your as a supplementary guide as you go through the entire strategic prevention framework planning process. So these best strategies, you find the options, you consider fit, you consider strength of evidence, and then you take your best fit options and strong fit, strong evidence of effectiveness, and you have a strong confidence then that your efforts are going to be rewarded. Again, conceptual fit, the degree to which a program or practice is a good match for the job that needs to be done. For example, a saw is a good match for the job of cutting a piece of wood. I imagine you can also do that with a hammer or screwdriver, but it's not going to work as well. It's going to take a lot more effort. So always want to be bringing that back to your planning group. I know this is a lot of work. I know you're putting forth a lot of effort, but by going through this process, we're hopefully going to be able to share lots of successes as we continue. Strategic fit, strategies, they're evidence-based, connected to your risk and protective factors, and a good fit for your community. And then, as I've already talked about, the practical fit, does the prevention strategy or intervention fit with the community's context and culture? Does the strategy or intervention have the support of the key leaders and staff that will implement the approach? And if they don't, that's something you need to work on, because, again, that will impact your effectiveness of implementation. And, again, this becomes something very, very critical. You're looking back somewhat at your capacity step when you think about this, and you're looking at all of the components of your infrastructure that are going to be needed to be able to implement this. And when you talk in implementation, which is your next step of the strategic prevention planning process, you're going to hear about something called fidelity. You probably are very, very familiar with that, but you need to have an infrastructure that's going to be able to implement with fidelity. Again, the entire presentation, that many of the activities that you engage in through all 5 steps of the strategic work make it more or less likely that you'll be able to sustain the effort. And so what you see here, and I'll go back to the project that I mentioned that I was part of, and this dates me. We actually started the project at the turn of the century. That sounds like it was a long time ago, but this is only 2020. But it was in the late 1990s that we started thinking about and developed a project for sustainability. So what we did was an extensive literature review and looked at what were all the factors that the research indicated, as well as some practical literature that was published by people who were in prevention and had been in prevention for a while. We also developed some think tanks with prevention leaders across the country, as well as included members of Center for Substance Abuse Prevention in the think tank, and spent about 2 years putting together what we call a sustainability model. I have continued to work on this throughout the years, and we now, colleagues of mine have developed a toolkit, which I've been a reviewer on and have made some contribution to. So this idea of sustainability, we want to be evidence-based as we start to think about, you know, what do you need to pay attention to sustain. So there, when you look again on the reference page, you'll see 3 studies that have been conducted using the sustainability model that indicate that it does increase the likelihood that a program or practice will be sustained. I'll just talk through each of these very, very quickly. But again, you can look at the references at the end if you want to learn more about any of this. I've already talked about compatibility, conceptual fit, cultural fit. That has to happen for successful implementation and for sustainability. The more simple the program or practice is to implement, the more likely it will sustain. This is just common sense. But if it is if you pick a program or practice that's very complex and that has lots and lots and lots of moving parts, over time, that's going to be harder to sustain. So so as you choose and think about remember we're talking about an evidence-based approach, high importance risk factor, changeability. We want to add into it as you're starting to think about, okay, how will this also impact sustainability? How simple or complex is this particular program? Does everybody have to continually be monitored? Does everybody have to be, every new person trained as they come into this? How extensive is the training? You know, we tend to have a fair amount of turnover in prevention. So are we going to, you know, spend lots and lots of money getting someone up to date on how to implement this very complex strategy, and then they're going to be promoted or otherwise leave our organization, and we're going to have to go through and train somebody extensively. So all of those are things to think about in simplicity. Ownership. This is why you need a planning team. You want as many people, especially people that are key leaders. And by leaders, I don't mean just people who are the recognized leaders in an organization or in local government. I'm talking about leaders, you know, among groups of people that are impacted by these problems. And so you need to think about, you know, you can always tell who a leader is in an informal group. When certain issues come up and questions are raised, people in the group will look to that person, and that person will many times be the one that responds. Relationships. And prevention, like any other human interaction, has a lot to do with relationships. So the better quality relationships that you have with implementers, that you have with administrators, that you have with even participants, those relationships with the evaluator. You need a good relationship with your evaluator. Your evaluator needs to be part of your planning team. Your evaluator they have a specific role, and they do have to retain some objectivity. but your evaluator needs to be part of the process, and they need to be continually feeding you information as you go through this process. Data resources, what we see is that, just as an example, when a state has developed a well-developed program or structure for gathering data and making data available to communities where they can use it for planning, use it for fundraising, getting extramural funds, that they are more likely to be successful. It's very, very difficult for a local community to produce the data that is needed, that's going to be reliable, that's going to be valid. And so having access to those data resources. Formalization is having practices and policies that are in code, codified, that are written, that support the implementation, that support the intervention are important. Having people that have the expertise to provide whatever services are needed to be provided. Having multiple funding sources is important. We see in the literature that those particular organizations that are always, seeking other funding sources. Now, you do have to make sure that you understand your mission as you do that you are accepting funding sources that are moving you towards your ultimate mission and helping you impact those risk and protective factors. Policies that I mentioned, again, as part of formalization, but policies that support using evidence-based interventions, for example. Some of the formalization that I skipped over, I want to go back to because it just occurred to me, is to make sure that you have, whether they're memorandums of agreement, MOAs, there are other, you have to know in your state the legalities of memorandums, but you want to have an understanding, for example, maybe that the school is going to always pay for the every other year prevalence survey, and that the police department is always going to provide this particular support. The more you can formalize that, the more that those particular arrangements will survive as you have turnover and people leaving and doing other things. The more formalized that is, the more likely you'll be able to sustain. I usually ask for a drum roll for this next and last. This is the most important component of sustainability. The literature shows this over and over and over again. Champions are people who will rise up to the call when you need support, and they can provide that support, and they can provide influence that your program is needed, it's vital, should not go away, and they'll do what they can to support it. They're all you, and you have to understand that you have different champions for different needs and aspects of the program. So again, you can find all of these discussed in the references that are at the end of the presentation. But sustainability, it takes usually somewhere between 1 to 4 years to get full implementation of a project. If we have a 5-year grant, and by year 4 we're actually now implementing at full capacity, and then we lose the funding and it's not sustained, we really do a disservice to a community, because they are just now starting to receive the full benefit of the program, and then it goes away. So the sustainability literature indicates that not only is it important for us to maintain the interventions, it's also to maintain the trust of the community. If we're going to do something important, we need to try to make it long-lasting. All right, so we've developed that comprehensive plan that aligns with the logic model. This is what a logic model looks like. Again, we started with our problems and related behaviors, our risk and protective factors. We now have chosen our programs and practices, and we need to now decide what will be the outcomes. When you think about outcomes, you think about short-term outcomes and long-term outcomes. Short-term outcomes are those that we expect will, within a fairly short time range, we'll start to see changes. And this might be in a risk or protective factor. It might be very early in a program, for example. It might be a change in knowledge or a change in opinion or a change in initial behaviors. Then you have long-term outcomes, which are usually defined as changes in the problems or changes in other types of issues that are associated with the problems. So you need to make sure, again, we've identified what the risk and protective factors are. The short-term outcomes should at least be measuring a change in knowledge or attitudes or early behavior. If we don't get those changes early on that the program or practice is supposed to initiate, then we don't expect that you're going to achieve your long-term outcomes. So if you're not achieving your short-term outcomes, that's a signal to go back to the planning phase, maybe even the assessment phase, and problem solve. What do we need to do to adjust because it's not working? As there's nothing wrong. In fact, it's very healthy to recognize that it's not working the way we hope, because it doesn't always. But waiting till a project is all the way through implementation and then getting an evaluation report that it wasn't successful, that's a waste in energy. It's a waste in funding. And so you want to make sure that you pay attention. And that, this is the overlap that with step 5 that I'll be presenting in 2 months. We'll come back to and emphasize that. But if you don't consider it now, by stage 5, it's too late. You've got to identify what those outcomes are, because you may need baseline data. You need to know that you have the capacity to actually be able to measure. And then you need to share the logic model. I suggest that at every coalition, if you're in a coalition, every coalition meeting, the logic model is prominent in the room. People need to be reminded of what you're doing, why you're doing it, that you have a systematic process, and you want their buy-in. So you want to share the logic model with all the important sectors of the community, the important sectors that are part of your effort, all the influential leaders, again, formal and informal. You want to share you want it on your website. You want it on as many communications as possible. It will be the opening of your evaluation presentation. It will be in the evaluation report prominently. The logic model then just becomes the roadmap. Everybody needs that conceptual representation. Wanda, I have concluded my part of the presentation. I'm going to turn it back over to you, and you can share some important information. But as we close, I just want to thank everyone who's taken the time to listen to me today. I know that some of you are already in the implementation phase. I just want to emphasize that what you do, the work that you do in the local communities, is where the water hits the wheel. And so I hope that you will continue to do what you do, and that the efforts of the Prevention Technology Transfer Centers that are supporting this will continue to support you, but you are where it happens. So thank you for what you do, and thank you for honoring me with this time today. At that, I'll turn it over to you, Wanda.
Thank you, Dr. Center. We appreciate the presentation today, and we appreciate you being willing to do this recording for everyone. As was mentioned, we want to be here to support you. So we've provided not only our website address, but also both the South-Southwest and the Mid-America mailing list links. So if you are not receiving training information and newsletters from us, you'll definitely want to be on our mailing list so that you're receiving all the up-to-date information. And any of the resources and the references that Dr. Center has provided on this next slide will also be made available on our website. So you can find those there. And if you just need additional technical assistance around this topic, you can send me an email at www.west@ou.edu. And lastly, here are those references, and we'll end on this slide. You can take a look at those, but again, you'll be able to link to those from our website. And we appreciate you for listening and being with us today. Thank you.